I'm going to be going over the crown preparation procedure.
So this week is session 4. We're going to be going over crown preparation. Lauryssa NWC. So first, you're going to seat your patient. Go over the health history form, making sure they didn't miss any questions, or if they have any questions about the ones on the health history form, making sure there's no new medications, surgeries, and then after that, you're going to go ahead and explain the procedure. And after that, if there's no questions and any of that, you're going to have the patient sign a consent form. After the consent form is signed, you're going to go over with the doctor if an x-ray is needed. If so, you're going to take one. Then you're going to take a preliminary impression if necessary for provisional coverage. There are 2 types of crowns, custom and prefabricated. Custom is the most common, but prefabricated is faster and has its advantage to it as well. Now, the procedure comes to a start. First, you're going to place your topical anesthetic, that right there. You're going to go ahead and place it on the gum area where they're going to be getting their local anesthetic. So, you're going to load the syringe and get it ready for the doctor. Once ready, the doctor will come in and numb the patient with their local anesthetic. So they're going to go ahead and numb it. While the patient is numbing, we will go over a shade guide to best match to the patient's current teeth. The doctor will then come in and confirm the shade if he likes it or not. Then the prep will begin. The doctor will begin to prep the tooth with a high-speed handpiece. A high-speed handpiece right there. And here's a few of the different burrs. Here's a 557, which is used to shape or remove decay. Here's a round burr. And here are some diamond burrs. And if the doctor still sees decay, he will use a spoon excavator to remove the remaining. This is right there, there's that instrument. And cord build necessary. It is for endodontically treated teeth, which means they most likely had a root canal, making the tooth weaker than usual. So cord buildup will be used to build up and reinforce it. It's either amalgam, glass anemometer, cast post. So the doctor will determine if a cord buildup is necessary. Then we'll go ahead and place the gingival cord. It is placed after preparation and removed before the impression. So we're gonna go ahead and take it out of its bottle that it comes in, and we're going to place it in a dapping dish with Hemendent, and we're gonna let it soak. Once done, we'll use our cord packer. There's a cord packer right there, and then there's the gingival retraction cord. We're gonna go ahead and pack it into the gum line. If the patient has heart issues, we may not be able to use the Hemodent, so confirm with the dentist. Impression time. How many we take is up to the dentist. It could be 1, it could be 3. It's up to the dentist. Before the final impression, we take a bite registration. So here's an impression in the whole mouth. And then here's a bite registration. You just put it right there and they bite down. You check their bite. And then we remove the retraction cord and we dry the tooth to take the final impression. We use a triple tray for final impression. It takes 3 impressions in one. It could take the tooth we are fixing, the opposing tooth, and a bite registration as well. So we use that for our final impression. Then we need to trim the provisional and adjust contact, then try to check occlusion. Then we cement. We do need to make sure it is strong enough and made well so it will stay for 2 weeks to 1 month. Then we fill out a lab slip. It's a prescription for making the appliance. And then we indicate what type of restoration and all that. Here's a example of a lab slip. We're gonna go ahead and fill all that out normally as you would. There's an example. Then we're going to go ahead and give the patient post-op instructions. So home care. Keep the area clean. Brush and floss area carefully so the gums don't get swollen. so we don't have a hard time cementing when the permanent crown comes in. Brush the temporary and surrounding tissue daily. Chew carefully. If it comes off, call right away, so we could go ahead and fix it and get it cemented again. If a bridge, floss underneath. Then schedule next appointment for the final restoration. So then once patient is okay and all questions are answered, the post-op is given, we could dismiss the patient.